You've been told to take a statin, maybe a baby aspirin, perhaps a blood pressure pill or two, and you've probably been following that advice faithfully for years, believing that those medications are what's keeping your arteries clear and your heart safe. But here's what almost nobody tells you. Those pills lower your cholesterol. They thin your blood. They drop your pressure. But they don't actually clean out the plaque that's already sitting inside your artery walls. They don't reverse the stiffness. They don't restore the flexibility you've lost. They manage numbers on a lab report, but they don't heal the damage that's been building for decades. And if you're over 60, that damage is there, even if you feel fine. Even if you've never had a heart attack or stroke. Decades of processed food, stress, inflammation, high blood pressure, and blood sugar swings have left deposits inside your arteries. Plaque, calcium, scar tissue. And those deposits are quietly narrowing the passageway, stiffening the walls, and setting you up for exactly the kind of cardiovascular event that changes everything in an instant. But here's the part that should give you real hope. The kind of hope that changes how you think about your heart health starting today. Your arteries are not static. They're not permanently clogged like old pipes that can only be replaced. They're living tissue. And living tissue can heal. Plaque can stabilize and even shrink. Inflammation can drop. Artery walls can become more flexible again. And blood flow can improve, sometimes measurably, sometimes in a matter of weeks or months, if you give your body the right tools to repair itself. And one of the most powerful tools, one that's been studied for decades and proven in clinical trials to improve artery health, comes down to a simple drink you can make in your own kitchen every single morning. Not a medication, not an expensive supplement, not something you order online from a questionable website. A real, whole food drink that works at the cellular level to support the lining of your arteries, reduce inflammation, lower blood pressure, and improve circulation. And the research backing this up is not fringe science. It's published in peer-reviewed cardiology journals. It's been tested in people your age. And the results are consistent and repeatable. In my years of practice, I've watched people in their 60s and 70s improve their artery health, reduce their chest pain, increase their exercise tolerance, and in some cases even reduce their medication doses by adding this one drink to their daily routine and giving it time to work. Same people, same age, different choices, different outcomes. And the difference wasn't luck. It was understanding what the arteries actually need to heal and providing it consistently. Before I show you exactly what this drink is and how to make it, do me a quick favor. If you want videos that teach you how to actually support your body's ability to heal instead of just managing symptoms with pills, hit subscribe, give this a like, and leave me a comment telling me your age and whether you've been told you have plaque in your arteries or high blood pressure. I read every comment, and your answers help me understand what's not being explained clearly enough in those rushed doctor visits. All right, let's get into it. But first, you need to understand what's actually happening inside your arteries as you age, because once you see the problem clearly, the solution will make perfect sense. Your arteries are not simple tubes. They're three-layered living structures. The innermost layer, the one touching your blood, is called the endothelium. It's a thin, delicate lining made of cells that are supposed to be smooth, flexible, and healthy. When that lining is working properly, it produces a molecule called nitric oxide, which is one of the most important substances for cardiovascular health that most people have never heard of. Nitric oxide tells your artery walls to relax and stay open. It keeps blood flowing smoothly. It prevents clots from forming. It reduces inflammation. And it stops cholesterol and calcium from sticking to the artery wall and forming plaque. Think of nitric oxide as your artery's natural defense system. As long as you're making enough of it, your arteries stay relatively clean, flexible, and open. But here's what happens after decades of poor diet, high blood sugar, high blood pressure, smoking, stress, and chronic inflammation. That delicate endothelial lining gets damaged. Tiny cracks and rough spots appear. And once the lining is damaged, it stops producing enough nitric oxide. Without adequate nitric oxide, your arteries can't relax properly. Blood pressure climbs, inflammation increases, and cholesterol, calcium, and inflammatory cells start sticking to those rough spots, building up into plaque. Over time, that plaque hardens, narrows the artery, and restricts blood flow to your heart, your brain, your legs, and your organs. That's atherosclerosis. That's what causes heart attacks and strokes, And the standard medical approach is to give you a statin to lower your cholesterol, hoping to slow the plaque buildup, and maybe a blood pressure pill to reduce the strain on the artery walls. Those help. But they don't restore nitric oxide production. They don't heal the endothelial lining. And they don't give your body what it needs to actually clean out and stabilize the plaque that's already there. So here's the question that matters. What does restore nitric oxide production? What heals the endothelium? What helps your arteries relax, reduces inflammation, and supports the natural clearing of plaque? And the answer, backed by decades of research, is dietary nitrates from specific vegetables combined with compounds that protect and restore endothelial function. And the single most effective, most studied, most reliable way to get those into your system every day is through a morning drink made from beets, leafy greens, and a few other targeted ingredients. Let me explain exactly why this works, because I don't want you taking my word for it. I want you to understand the science so you can make an informed decision. Beets, and to a lesser extent leafy greens like spinach and arugula, are rich in natural nitrates, not the artificial nitrates added to processed meats, which are harmful. Natural plant nitrates, which are completely different. When you consume these nitrates, bacteria in your mouth convert them into nitrite. That nitrite gets swallowed, absorbed into your bloodstream, and then converted into nitric oxide, the exact molecule your damaged endothelium is struggling to make on its own. This isn't theory. This is a well-established biochemical pathway that's been studied exhaustively, and the results are remarkable. Study after study has shown that people who consume beetroot juice or other nitrate-rich vegetables experience significant drops in blood pressure, improved blood flow, better exercise capacity, and measurable improvements in endothelial function. One landmark study published in the journal Hypertension found that drinking just 1 cup of beetroot juice daily lowered blood pressure by an average of 8 points systolic and 4 points diastolic within hours, and the effect lasted for weeks with continued use. That's equivalent to adding a blood pressure medication, except you're fixing the underlying problem instead of just masking it. Another study specifically in older adults with heart failure found that drinking beetroot juice improved exercise tolerance, meaning they could walk farther and do more before getting short of breath because their blood vessels were relaxing and delivering more oxygen to their muscles. And research from the University of London found that nitrate-rich vegetable consumption was associated with significantly lower rates of cardiovascular disease and stroke in large population studies following people for decades. But beets alone aren't the whole story. To maximize the benefit, you want to combine them with other ingredients that protect the endothelium, reduce inflammation, and support overall artery health. And that's where the complete morning drink comes in. Here's exactly what you need and why each ingredient matters. The foundation is 1 medium-sized raw beet, or about 4 ounces of pure beetroot juice with no added sugar. The beet provides the nitrates that convert to nitric oxide. Use raw beets or cold-pressed juice, not canned or heavily processed, because heat and processing destroy some of the active compounds. Second, add a handful of fresh spinach or a small handful of arugula. These greens add additional nitrates, and they also provide magnesium and potassium, 2 minerals that are critical for blood pressure control and artery relaxation. Most people over 60 are deficient in magnesium, and that deficiency directly contributes to artery stiffness and high blood pressure. Third, add half a lemon, juiced. Lemon provides vitamin C, which protects nitric oxide from breaking down too quickly in your bloodstream, making the effect last longer. Vitamin C is also a powerful antioxidant that reduces oxidative stress, one of the main drivers of endothelial damage. Fourth, add a small piece of fresh ginger, about ½ inch. Ginger contains compounds called gingerols that have strong anti-inflammatory effects. Chronic inflammation is what drives plaque formation and artery stiffness, and ginger helps calm that inflammation at the cellular level. Fifth, add 1 small clove of raw garlic. Garlic contains allicin, a sulfur compound that's been shown in multiple studies to lower blood pressure, reduce cholesterol, prevent platelet clumping, and improve endothelial function. It's one of the most studied natural cardiovascular protectors we have. And finally, add about 4 ounces of water and blend everything together until smooth. If the taste is too strong or too earthy, you can add a small piece of apple or a few berries for natural sweetness. But keep it minimal because you don't want a sugar load that spikes your blood glucose and defeats the purpose. That's it. Beet, greens, lemon, ginger, garlic, Water. 6 ingredients. Blend it fresh every morning and drink it on an empty stomach or with breakfast. The whole process takes less than 5 minutes, costs less than $2 a serving, and delivers more cardiovascular benefit than most supplements you could buy. Now let me show you what this drink actually does inside your body when you consume it consistently. Within 30 to 60 minutes of drinking it, the nitrates begin converting to nitrite and then to nitric oxide. Your blood vessels start to relax. Your blood pressure begins to drop. Blood flow to your heart, brain, and extremities improves. Over days and weeks, as you drink this consistently, your endothelial cells start to heal. They begin producing more of their own nitric oxide again. The chronic inflammation in your artery walls starts to calm down, and the environment inside your arteries shifts from one that promotes plaque buildup to one that stabilizes and even shrinks existing plaque. Studies using advanced imaging have actually shown that in people who consume high amounts of dietary nitrates from vegetables over months and years, arterial stiffness decreases and plaque burden can reduce. The arteries become more flexible, blood flows more freely, and the risk of heart attack and stroke drops measurably. This is not a magic cure. This is not going to reverse decades of damage overnight. But it is a real evidence-based intervention that supports your body's natural ability to heal and protect your cardiovascular system. Let me tell you about a patient I'll call Robert, because his story captures exactly what's possible when you take this seriously. Robert was 67 when I met him. He'd had a mild heart attack 2 years earlier. A stent had been placed in one of his coronary arteries. He was on a statin, a blood pressure medication, a baby aspirin, and another medication to protect his heart. His blood pressure was controlled. His cholesterol was down, but he still felt limited. He got short of breath walking up a hill. He felt like his energy was never quite what it used to be, and he was frustrated because he was doing everything he'd been told, but he didn't feel good. We talked about his diet, and it was typical. Not terrible, but not targeted. He was eating some vegetables, but not the right ones. No beets, very little leafy greens, lots of bread, pasta, and processed foods. I explained the nitric oxide pathway to him. I told him about the research, and I asked him to commit to one thing. Every single morning, make this drink and have it with breakfast. Give it 12 weeks and let's see what happens. He did it. Every morning. Beet, spinach, lemon, ginger, garlic, water, blended and consumed. Within 2 weeks, he told me he felt like he could breathe a little easier on his walks. Within a month, he was walking farther without stopping. Within 3 months, his blood pressure, which had been controlled but on the higher end of normal, dropped enough that his cardiologist reduced one of his medications. And his exercise tolerance, measured on a treadmill test, had improved significantly. He felt better than he had in years. His arteries didn't go back to being 20 years old. The damage from decades of poor habits doesn't fully reverse, but they healed enough, they relaxed enough, and they functioned well enough that his quality of life improved dramatically. And 5 years later, he's still making that drink most mornings. Still active. Still independent. Still avoiding another heart event. That's what's possible when you understand the biology and you give your body what it actually needs. Now, I need to be very clear about a few important cautions because this drink is powerful and it interacts with certain medications. First, if you're on any blood pressure medication, this drink can lower your pressure further, which is generally good, but it can occasionally drop it too much, especially in the beginning. So if you're on blood pressure pills, start with a smaller serving, maybe half the recipe, and monitor your pressure at home. If it drops below 100/60, or if you feel dizzy or lightheaded, talk to your doctor about adjusting your medication dose. This is a good problem to have, but it needs to be managed properly. Second, if you're on warfarin or Coumadin, be cautious with the greens in this recipe because they contain vitamin K, which can interfere with how warfarin works. You can still drink it, but you need to be consistent, meaning if you're going to have it every day, do it every day so your doctor can adjust your warfarin dose accordingly. Don't have it some days and skip others because that makes your INR, the blood test that monitors warfarin, unstable. Third, beets can temporarily turn your urine or stool a reddish color. That's completely harmless and it's called bacteria, but I'm telling you now so you don't panic and think you're bleeding. It's just the pigment passing through. And fourth, if you have kidney stones or a history of oxalate stones, talk to your doctor before consuming large amounts of beets and spinach regularly because they're high in oxalates, which can contribute to stone formation in susceptible people. For most people, this isn't an issue, but if you have that history, it's worth discussing. Now, let me address the question I know some of you are thinking. Can I just take a beetroot supplement instead of making the drink? And the honest answer is that supplements can work, but they're not as effective as the real thing. Whole beets and greens contain fiber, enzymes, cofactors, and other compounds that work synergistically with the nitrates. The fresh lemon protects the nitric oxide. The garlic and ginger add additional cardiovascular benefits that a beet pill doesn't provide. And there's something about consuming whole foods that our bodies recognize and respond to better than isolated extracts. That said, if you absolutely cannot tolerate the taste, if you travel frequently, or if making the drink daily just isn't realistic for you, a high-quality beetroot powder or beetroot juice supplement can be a reasonable second option. Look for organic, cold-pressed with no added sugar, and a standardized nitrate content. The dose should provide at least 300 to 500 milligrams of dietary nitrates per serving. But I'm telling you, the real drink is better, cheaper, and more effective. So here's your exact action plan, because knowing what to do and actually doing it are two very different things. First, this week, go to the grocery store and buy fresh beets, fresh spinach or arugula, lemons, fresh ginger, and garlic. Don't overthink it. Don't wait. Just buy the ingredients. Second, tomorrow morning, make the drink. 1 medium beet peeled and chopped, a handful of spinach, half a lemon juiced, a half-inch piece of ginger, 1 small clove of garlic, 4 ounces of water. Blend until smooth. Drink it with or right before breakfast. If the taste is too strong, add a small piece of apple or a few frozen berries to sweeten it slightly. You'll get used to the taste within a few days. Third, commit to doing this every single morning for 12 weeks. Not occasionally, not when you remember, every single day. That's how long it takes to see the real changes. Your blood pressure will likely improve within days or weeks, but the deeper endothelial healing, the plaque stabilization, the improvement in artery flexibility, that takes consistent intake over months. Fourth, monitor your blood pressure at home if you're on medication. Check it in the morning before you take your pills. Write the numbers down. If it starts dropping into the low 120s or below 100 systolic consistently, call your doctor and ask whether your medication dose needs to be reduced. This is a good outcome, but it needs medical oversight. And fifth, don't stop your prescribed medications without talking to your doctor. This drink is not a replacement for your statin, your blood pressure pill, or your aspirin. It's an addition. It works alongside those medications to address the root cause they're not fixing. Over time, as your health improves, your doctor may be able to reduce doses or eliminate some medications, but that decision needs to be made together based on your labs and your symptoms. Let me tie this all together, because this is the part that determines whether the next 5 or 10 years of your life include vitality and independence, or whether they include stents, bypasses, strokes, and limitations. Your arteries are talking to you right now. If you're short of breath, if you're tired, if your legs ache when you walk, if your blood pressure is high despite medication, if you've been told you have plaque. Those are all signals that your endothelium is damaged and your nitric oxide production is inadequate. The standard medical system will give you pills to manage the symptoms, and those pills help, but they don't heal. They don't restore function. They don't give your arteries what they need to repair themselves. This drink does. It provides the exact precursors and protective compounds your endothelium needs to start producing nitric oxide again, to relax, to reduce inflammation, and to create an environment where your arteries can heal. This is not alternative medicine. This is evidence-based nutritional biochemistry. It's what your arteries would ask for if they could talk. And the choice is yours. You can keep doing what you've been doing, taking your pills, hoping they're enough. Or you can add this one simple drink, this one daily habit, and give your body a real chance to heal from the inside out. You're not too old. Your arteries are not beyond help. But time matters. Every day that passes with damaged endothelium, low nitric oxide, and ongoing inflammation is another day that plaque builds, stiffness increases, and risk climbs. Start today, not Monday. Today. Now, everything we talked about today is about unclogging your arteries and improving blood flow naturally. But there's one vitamin deficiency that's epidemic in people over 60, and it directly causes your arteries to stiffen and calcify faster than almost anything else. Most doctors never check for it. and most people have no idea they're deficient until the damage is done. I made a video explaining exactly what that vitamin is, how it protects your arteries, and how to get enough of it safely. I'll put it right here on the screen. Go watch that one next, and I'll see you there. This is Dr. Robert Chen, looking out for you.